I'm here with Steve Bulger, Regional Administrator for the Small Business Administration Atlantic Region. Thank you for being with us today.
Great to be with you.
So for some background, what does the Small Business Administration do, and particularly what does your region encompass?
So the Small Business Administration is the federal government's primary agency to help small businesses. In normal times, we provide capital access, training and mentoring for small businesses who want to start and grow, and also access to government contracts and how to get involved in that. However, since the pandemic started, we've really just been focused on supporting our small businesses get through this shutdown period and set them up to restart, reopen, and get going again. And the region I cover is Region 2 and 3. It's basically from New York down to Virginia and all the states in between.
The Paycheck Protection Program Flexibility Act, which was recently put in place, has amended some things on the original Paycheck Protection Program. What are some things that this new act has changed?
There's two big components in the Paycheck Protection Program Flexibility Act that was signed into law last Friday, and it has to do with the forgiveness portion of the loan. So nationally, SBA has done over 4.5 million loans to small businesses for over $500 billion. Almost everybody wants to have their loan forgiven. There's some who don't, but almost all companies I talk to want their loan to be forgiven. One of the challenges was they had to spend 75% of those loan proceeds within an 8-week period after they received the loan. And for a lot of companies, that wasn't a problem. However, for some companies, that was a challenge, and there was some industries in particular, like the restaurant industry, that were having real challenges with those rules. So Congress listened to small businesses, listened to feedback that we gave them, and they made some changes. The first is they extended the 8-week period to 24 weeks. So instead of having to use 75% of your payroll within 8 weeks of the loan proceeds, you now have up to 24 weeks, which is a really big change and something that's really helping a lot of companies. The other major change was in that percentage. Instead of having to spend 75% on payroll and benefits to your employees, you now only have to spend 60%. And if you do that during that 24-week period, the entire loan will be forgiven.
And how can business qualify for full forgiveness, or what are some of the requirements for different levels of forgiveness of their loans?
Sure. The main thing now is no matter when you got that loan, the program started on April 3rd. It's still open. And the other thing I did want to mention is the program still has over $100 billion of money available to small businesses and eligible nonprofits. So we're really encouraging them to apply within the next couple of weeks, because the program is right now tentatively scheduled to shut down on June 30th from taking new applications. But in terms of that forgiveness, the key number is those two key numbers. As long as you take 60% of the proceeds of the loan that you get from your lender, and over the course of that 24-week period, pay payroll, wages, and benefits to your employees, then the entire loan will be forgiven. The other 40% of the loan, there are some restrictions on that and how that can be used, however. That's an important thing, too. That can be used for rent, utilities, or interest on mortgage payments. So it gives a little bit more flexibility to our small businesses to use it for those types of fixed costs in addition to payroll.
What do people need to do to apply?
So the best advice we can give on that is go to our website, sba.gov, and on that you can click down into our COVID response. You'll see the details of the Paycheck Protection Program along with a list of lenders across the state of Pennsylvania. Right now, there was over 600 lenders that were doing these paycheck protection loans across the state. And that ranges from the biggest banks all the way down to very small community banks and credit unions. So if you are interested in that, go to that site, read about the program, and then contact the lender. They will then help you walk through the process to get your application in. It's not that difficult. And once they get that application into us from the lender, SBA will turn around, approve the loan, and within a few days, you should have your money in your account.
Will any of the changes in the new Flexibility Act affect people who have already received a loan or already applied for a loan?
There are a couple changes. Certainly anyone who has gotten a loan, and like I said, there's been, in the state of Pennsylvania alone, we've already approved 158,000 small businesses for loans worth over $20 billion. So Pennsylvania has really taken advantage of this program across the board, and we're really pleased about that. But yes, so if you do have an existing Paycheck Protection loan and you're looking to make sure you're going to get that forgiveness, you now have a little bit more time. You can breathe a little easier. You don't have that 8-week deadline, which for a lot of companies was coming up this month. Now you have more time. There is on the SBA website, there is information on forgiveness, and there is a forgiveness application form. Now, that is going to be modified very soon, hopefully within the next few days, based upon the changes that Congress implemented last week. So I would hold off on filling out that form until the new version comes out any day now. But then all you have to do is plug in the information and get that to your lender. The lender will then submit it to SBA, and SBA will sign off on it. The loan will be forgiven, and the lender will be completely reimbursed for their money. So it's a pretty standard process. If there's any questions, please feel free to reach out to us at any of our district offices or any of our resource partners like small business development centers, women's business centers, etc. We're happy to help walk people through the process.
What kinds of feedback are you getting from people who have already received these loans?
I'll tell you, the feedback has been tremendous. So many people we've talked to were desperate for money, right? I mean, their business out of the blue, the economy was roaring along, and then out of a blue, it's like we hit a car crash, just hit the wall, and everything stopped, the revenue stopped, and then a lot of small business people were really upset and really frustrated and very worried about how they were going to meet their payroll, how they were going to pay their bills and bring home money to for their own families. This program has been a lifesaver for a lot of small businesses. That's what we're hearing. A recent study just came out from the National Federation of Independent Business that showed that about 75% of all small businesses with employees across the country have gotten a Paycheck Protection loan. So there were some problems initially rolling it out just because the amount of applications we got was overwhelming. Everybody wanted the money immediately, but we worked our way through those problems, working with our lenders who have been terrific in this, our banks and credit unions. They've been a great partner in this. So a lot of those problems were worked through, and I would say, and the feedback we're getting is that the program has been really well received.
You mentioned already there's still over $100 billion left for funding for this program, and the deadline, as you also said, is June 30th. Do you anticipate that this program will continue and being funded after that deadline, or do you think these funds will be exhausted and support will happen in some other way?
That's a great question. We're going to have to wait and see. We do believe that just based on the run rates we're seeing, there probably will be money left over in the program. We probably won't spend the entire amount. We've already loaned out $510 billion. The program calls for about $640. So there is going to be some money left over. That will be up to Congress to decide what they want to do with that. There's some proposals that they're floating around down there. We'll just have to wait and see. But certainly more support for small business is something that both the administration and Congress is keeping a very close eye on. And if small businesses need more help, we think it will be coming.
And finally, this Paycheck Protection Program is probably the main interest for people in your organization. But what are some other ways that the Small Business Administration is supporting local businesses, and what are some other ways that you plan on supporting them in the future?
Sure. Well, as I mentioned earlier, we have a lot of programs that we normally run to support our small businesses, lending programs, education, training, mentoring. All those are going to be continuing. We do think Congress is going to be giving us more resources, given the impacts this pandemic has had and the need for more counseling, more mentoring, more capital access for our small businesses. So we do think there are some programs that are going to be coming down the road. One of the things that's been really good so far is Congress appropriated billions of dollars to have the SBA pick up the payments, both principal and interest, of any existing SBA loans that were already out there before the pandemic hit. And that's been a big advantage. We're hearing from a lot of small businesses that are thankful that SBA is picking up their loans during this shutdown period. So there's a combination of things that are going on, and we think it's only going to continue right through the end of the year, probably into next year as well.
All right, Steve Bulger, Regional Administrator for the Small Business Administration Atlantic Region. Thank you so much for your time.
Great to be with you. Thank you.
Join our guests for insights on issues impacting local government and the citizens of Pennsylvania. Created by the Pennsylvania State Association of Boroughs, Inside Pennsylvania Boroughs connects you to legislation and policy that will affect you and your family. Your host, Chris Kapp, and his guests discuss current affairs that matter to you most. Connect with your state by tuning into Inside Pennsylvania Boroughs on Sundays here on PCN.
I'm here with Dr. David Rubin, Director of PolicyLab at Children's Hospital of Philadelphia. Thank you for being with us today.
Glad to be here.
So to start, what is PolicyLab and what does it do?
PolicyLab is a research center at the Children's Hospital of Philadelphia that focuses on translating evidence on what's best for children and families toward the types of services and programs we'd like to see for those families in the community.
So through your research, what have you found about the influence that weather, for example, heat and humidity will have on the spread of the infection in the summer?
Sure. Well, first I'd like to say, given our mission that I just described, a lot of people ask me, how did you get involved in doing these kind of models around the effects of weather, the effects of social distancing, and doing these forecasts related to the COVID-19 epidemic. And the reason is because we knew from our families, we were concerned early on that our families, particularly our working families, would be facing the impacts of both COVID directly and then the loss of their jobs and the concerns about their non-COVID related issues at home, whether it be their health or other needs they might have had at home. And so if we could be part of the conversation in terms of how to safely reopen communities, then we thought we were abiding by our own mission as a center at Children's Hospital of Philadelphia, and trying to do what's best by our families. Now, to your question about weather, we were one of the first groups that really took a vantage points of thinking about the ways in which local communities would have different experiences through this epidemic. And one of the factors we thought might be most important would be whether there was a seasonal effect. And what we found in our models is that there indeed is a strong temperature and humidity effect that, particularly over the moderate ranges of temperature up to about 65, 75 degrees, really helps to mitigate transmission of the disease. As you get into the higher temperatures, you sometimes have trouble, a little bit of trouble with what we call, human behavior mixing with the temperature effects. Temperature clearly degrades the viability of the virus and the ability to transmit it, but people like to go outside and they gather more as temperatures go up and they start to conflict. And so the higher temperature effects start to degrade a bit as people spend more time together outdoors.
And in looking at your data, how do your researchers differentiate between the trajectory of the virus in urban areas where people are highly congregated versus rural areas?
One of our biggest factors is population density. We also look at factors like poverty, the prevalence of health conditions, crowded living conditions, which tend to be more likely in urban areas, and you see significant effects. And so when we're doing a forecast, we have to, we have to incorporate that because the risk to an urban area is obviously much higher than a risk to a rural area because it's just easier to space out.
So in your forecast, you use data from all over the country. Based on data that you've collected from Philadelphia, how do your projections and forecasts for the city of Philadelphia, which has been a hotspot for the pandemic in Pennsylvania, compared to the projections for cities in other states across the country?
Well, Philadelphia has done a nice job, like most of the northeastern cities, of degrading their case counts. Some would argue that the shelter-in-place strategy was too long, but I think that the places that did shelter longer are going to reap the benefits because the time it takes to double cases, if you're starting from 50 or 100 cases, as opposed to 1,000 cases, is much longer to actually get a significant impact where your individual likelihood of running into someone with COVID on the street or inside a restaurant is much lower. So right now, Philadelphia's forecasts have been fairly stable. We haven't degraded cases completely, and I suspect it'll be hard to extinguish all the cases. But if people are vigilant by wearing their masks and focusing on hygiene and disinfection, and really trying to protect each other, particularly in those areas like those crowded indoor locations, I think Philadelphia can do well through this epidemic, but it really comes down to individual responsibility and the routines that we adjust in our regular lives to protect each other in the months ahead.
How are you and your team engaging with policymakers to help manage the COVID-19 response?
Well, we've got, our models have been well received because we're in nearly 400 counties, and we're probably going to grow that number in the next week to get even some smaller counties in there. But because we're so focused on local metropolitan areas and counties, they're just a lot more helpful to state leaders in particular, and some of our national leaders in terms of understanding how the epidemic is moving across the country. To say, like, for example, if you look at the headlines today, to say, for example, that Arizona is getting worse. Well, that's true, but it's not everywhere in Arizona, or California is getting worse. Well, if you go up to Sonoma County is okay, but the areas around Los Angeles and going into the Central Valley and down through the Inland Empire area, which is like Palm Springs and those areas, they're looking really troublesome. And so it's really important, those details really matter from a state response because you don't want to overreact in areas that may be doing fine. You want to focus on areas that are your trouble spots and try to calibrate your response to meet the needs of these local areas.
Obviously, people are concerned about the spread of COVID-19 and people getting infected, but has your research team looked at the impact of COVID-19 on mental health?
We haven't looked at the impact on mental health. We suspect it to be there, and one of the reasons we've been focusing so hard on reopening communities safely because we consider that the competing risk. We do have a behavioral health team in PolicyLab, and I would ask folks to stay tuned. We have a new guidance coming out about the mental health issues, but they're sort of separate projects. We're not measuring mental health in the forecast project. We're actually focusing on it as a separate project.
And how has your team provided guidance on how schools should reopen in the fall?
Well, we've worked with local and state leaders to help, and also not just as PolicyLab, but alongside our infection control team at Children's Hospital of Philadelphia to incorporate all the guidance we were seeing in the latest available evidence to try to help school districts reopen safely for the fall. There's a difference between guidance and actual practical strategies. What are we going to do? And so to help them focus, well, what does it mean to say we're going to socially distance students, or what's practical in the context of how school districts run, how we're going to do busing, how are we going to do hand hygiene and disinfection, when are we going to go to remote learning. All these issues are very, they're very detail oriented, and trying to develop practical strategies that can prioritize kids getting back to school has been a huge focus of our team.
And finally, what influence do you think this past week and continued protests will have on your data and your projections for the future?
It's a great question. Our data release today is focusing on the Memorial Day, which was the first pulse to the system where people were mixing, particularly outdoors. And what we've seen is that areas of the country in which there was already a heightened risk and there were a fair amount of circulating cases, those are the ones that seem to be doing worse as we incorporate the impacts of Memorial Day. It takes about 2 weeks to see these signals because, from the time you're exposed, it might be a week or a week and a half before you actually see a doctor, because it takes a few days to get sick. And then it takes a few days for you to decide you want to go to the doctor. And then it takes a few days for you to get a test. So it usually takes about 2 weeks to see those effects. So I don't think we have the full picture of the demonstrations yet, but what we have for Memorial Day suggests that if you lived in Texas or in Arizona where things were already getting worse, things got worse and much more significantly. But if you're in areas like Philadelphia, in New York City, and the travel to the New Jersey shore, assuming people were vigilant, we haven't seen a big uptick yet in the New Jersey shore locations, nor in Philadelphia or New York, which to me, is an early indicator that if people were cautious and given the hard work that people have done, those cities in which they had sort of degraded their cases are less likely to see a big bump from the demonstrations. And you keep in mind the demonstrations were outdoors, and outdoor transmission tends to be less. We worry more about crowded indoor locations. So, we're watching anxiously this week to see what the results will be, but I'm not presupposing that there's going to be this huge spike everywhere in the country because people were demonstrating. I think it's going to be selective to areas based on where they were when those demonstrations started in terms of the risk in their communities.
All right, Dr. David Rubin, Director of PolicyLab at Children's Hospital of Philadelphia. Thank you for your time.
Anytime, all right.
After a great victory over Union forces in June 1863, Robert E. Lee marches his army to Pennsylvania. The advancing Confederates clash with General Meade's Union Army at Gettysburg, beginning the most famous battle of the Civil War. Explore our nation's past and the Gettysburg battlefield with the Gettysburg Collection. Become a member to stream the library online. Learn more at gettysburgcollection.com.
Resa Jones, chair of the Epidemiology and Biostatistics Department at Temple University. Resa, what is it you're teaching to your students?
Hi, Larry. Thank you for having me. Our department is the Department of Epidemiology and Biostatistics. And as part of our training mission, we actually cover the methods of epidemiology and biostatistics, covering everything from chronic diseases and infectious diseases to methods such as study design and the proper analytic tools to do research.
You're starting a program that teaches contact tracing. Just what is that exactly?
So contact tracing actually is a public health surveillance tool that is used once there is an outbreak or some kind of epidemic or pandemic. Cases are identified, and then those cases give the information about people that they might have come in contact with. And contact tracing then is a mechanism to follow up with those people who have been exposed to somebody who has tested positive for a disease, and to talk with them about prevention strategies, quarantine and isolation as necessary, and then different social services, for example, that they might need to be able to quarantine themselves.
And with Pennsylvania gradually reopening, why is it important to teach this program now?
It's very important. In order to really reopen the state, there are different containment strategies that need to be in place. First, we need mass COVID-19 testing, and this is the testing, not the serological antibody testing, but the testing for COVID-19. As cases lessen and the numbers decrease, then we're able to start doing the contact tracing. This allows us to help people quarantine so that less people in the overall population will be exposed.
Now, you've developed a curriculum for your program. Just how exactly will it go?
So the curriculum actually is 12 different modules. The program will be about 10 hours. It's self-paced and it's online. There are recorded presentations, and the bulk of it is asynchronous. There is one culminating experience that needs to be done synchronously with a member of our team. But the different topics that are covered are basics of infectious disease and COVID-19, determinants of disease and surveillance, and then prevention of and testing of COVID-19, isolation and quarantine. Then we do a general contact tracing, so something that would be similar for food outbreaks. or other outbreaks such as measles. We also have ethics and privacy training, and then risk communication, which is very important for contact tracing. That's followed with health equity and vulnerable populations, and then a rapport building and respect module to help people be prepared to interview and work with the community residents. Then we have a contact tracing training that's focused on COVID-19, and then that culminating experience of a mock phone certification with one of our team members.
Well, let's talk about interviewing, Resa, because I was reading a press release from Temple about the program, and it says that students will learn about disease transmission, quarantine, those are obvious. Then it says motivational interviewing. So I'm curious, tell me about the significance of the word motivational.
Well, yeah, so the motivational interviewing is really just meant to be an opportunity or a way that we solicit information and encourage people to give us information and share information. So it involves probes or different interviewing techniques to get as much information and the full, really the full degree of information that we need to accurately document and provide information to the state.
Resa, in the interest of really trying to crystallize this in our viewers' minds, I understand that students have to make at least one practice contact tracing phone call. So kind of tell me, if you can, anecdotally, how such a phone call would go.
Sure. So we actually have different practice modules or vignettes for people so that they can get prepared and feel comfortable. That contact tracing interview entails contacting a person, and this would be very much akin to what would happen once they would be contact tracers for the state or Philadelphia or a different jurisdiction. They would contact that person, verify that it's the person that they're wanting to talk with, and then they would ask different questions about the contacts they have had, whether or not that they're experiencing any symptoms of disease. They would go through prevention strategies and how the person would need to quarantine. If that person actually does have symptoms, they would refer them to testing. So a lot of it is not only obtaining information, but sharing information with the contact so that they can better protect their health and those of their family, others in the home, and then the community at large.
So I'm guessing there are some techniques to make people relax when they're contacted about something like this. After all, it is unprecedented, and what can the interviewer do to make this process go as easily as possible, and of course to get accurate, complete information?
Sure. So in terms of developing rapport, having a conversational tone, being very comfortable with that script or the information that needs to be shared are really essential. We don't want any of the people that we train to sound like people who are being rushed or aren't empathetic and respectful of them. And then with the aspect of accurate data collection, each jurisdiction has different data collection protocols and different data entry systems. So that will really depend. But for example, for the state of Pennsylvania, there is an online module where data is entered into very specific data fields. And our training, we are mimicking that training and that data entry so people can practice without having access to that online entry tool.
When students complete the program, how do you get them out in public where they can do some good?
Sure. So it depends on who they'll be working with. With the state of Pennsylvania, people will need to register through the state's PA Serve. And through that, they'll have a criminal background check, etc. After our training, then they will actually do a 1.5 to 2 hour training with the state, given the state's data collection procedures and protocols. If, for example, it's with Philadelphia, then people would need to register for the Medical Reserve Corps of Philadelphia and get connected that way. And each jurisdiction will be slightly different.
It sounds like the state can help you get your contact tracers out where they're needed the most.
Yes, we're working with them, and they've initially requested that we have 200 students or people available to help do contact tracing in 5 of the 10 counties in the Northeast region of the state. We've also talked about helping with other counties. But yes, once we train, really it will be up to them to be administering and making sure that the contacts are being called. They have nurse administrators in most of the counties that are responsible for that coordination.
How much interest are you able to gauge among Temple students right now in your program?
Well, we initially about, over a month ago, we had solicited the numbers of students that might be interested for degree requirements or internships or practicums. And our estimate was about 200 students to about 400 students, depending on when the training would happen and when the students would be available. Now, beyond that, I'm getting multiple emails from people just who are community residents or alumni, people who have family members that would like to do the contact tracing, and we'll be opening it up to the public after we have started with our students.
I understand there's a relationship with the School of Dentistry as well, right?
Yes, actually, when I mentioned we had solicited feedback to see how many students might be interested, that 200 to 400 estimate includes dentistry and pharmacy. And we've also since heard that there might be some medical sciences students that are interested too.
You said that the course requirements take 10 hours to complete. When does this program start? If you can tell us at least approximately.
Sure. Well, we're hoping it starts later this week, if not the beginning of next week. So anywhere between June 8th and June 15th, I would say.
And the sooner the students complete the program, the better. Is there a way to motivate them through this process?
Right. Well, because it's self-paced and, overall it's 10 hours, but it's about 6 hours of online modules. And then the other 3 to 4 hours is actually prep and practice to prepare for and really be able to be as competent as possible in that contact tracing phone certification. So I know that most of our students are already very self-motivated for the sheer reason of being able to help protect the public's health, particularly in our College of Public Health, as well as dentistry and pharmacy at Temple.
Rena, last question. If someone watching this program is interested in participating in the program and becoming a contact tracer, what should they do?
Well, actually, we're going to be posting the link for this program. It'll be on our College of Public Health website. I wish I could remember the URL right now, but if they go to cph.temple.edu, there should be a prominent link for the COVID-19 contact tracing. Otherwise, it will be available through our continuing ed link, the continuing ed link for non-credit at Temple.
All right, that sounds like a good start. Resa Jones, Chair of the Epidemiology and Biostatistics Department at Temple University. Thank you very much for your time.
Thank you, Larry.